According to WHO, around 422 million people worldwide are suffering from diabetes, but more than half of the people don't get diagnosed until they develop complications. Diabetes is a common worldwide disease commonly known as high blood sugar level. If you are having frequent urination, increased thirst, weight loss, and numbness in your hands or feet, then you should check your blood sugar level because once it gets started, it will last for your whole life and worsens with each passing day. But the good thing is, if it gets diagnosed early, you can control it and prevent yourself from developing complications and can lead a near-normal life. A simple blood sugar test is required for its diagnosis that can save your life. In this video, I am going to tell you the 10 most unusual symptoms of diabetes which most of us ignore in our daily life. But before moving on, note that all the information in this video is fact-checked by qualified healthcare professionals and is for information purposes only. Number 10, weight loss and weight gain. Diabetes can be responsible for both weight loss and weight gain. But this mainly depends on the type of diabetes you may have. If you have type 1 diabetes, in which your body's pancreas is not able to form insulin in the first place, you may notice weight loss. But if you have type 2 diabetes, you may notice a weight gain, since your pancreas is producing insulin, but your body cells are not able to utilize it, and hence it gets accumulated in your blood. If you are wondering how this excess insulin causes weight gain, then here is your answer. Insulin is an anabolic hormone, a substance that will make things up in your body like fats and proteins, which will add up to the bulk of your body and hence cause a weight gain. In type 1 diabetes, your body cells don't have access to glucose because of a lack of insulin, so it uses other substances like lipids and proteins to gain energy and hence deprive the body of its bulk, resulting in weight loss. Number 9. Darkening of skin. If you have type 2 diabetes, your body won't be able to use insulin and it will accumulate in your blood. This excess insulin is then responsible for the darkening of your skin, especially on the armpits, elbows, knees, and groin. But most commonly, they can be seen on the skin at the back of your neck. The skin will become thicker and velvety in texture and appear in the form of creases. Number 8. Changes in vision. Diabetes increases the risk of cataracts, glaucoma, and blurry vision. These are the diseases of the eye that affect the lens in your eyes. A cataract is the formation of a cloudy area in the lens of the eye, and the lens becomes thick and less flexible, while in glaucoma, the optic disc that is present at the back of your retina becomes damaged. This will affect the optic nerve in the back of the eye and can result in vision loss and blindness. Another factor that adds to causing glaucoma in diabetes is the development of abnormal blood vessels in the retina, which will result in blocking fluid from draining out of the eye, adding to an increase in the pressure of the eye, and resulting in glaucoma. Number 7. Frequent infections. Immunity is another thing that is affected the most in people with diabetes. High blood sugar levels in the body make your body immunocompromised. This means that your body's natural capability to fight infections and heal itself will become affected. Hence, you may experience frequent infections like pneumonia, urinary tract infections, yeast infections of genitalia, especially in females, and the common cold. Not only that you will have more infections, but your body will need extra attention and more care to heal. High blood sugar levels impair white blood cell function, which are main force to fight against infectious agents. So even minor infections have to be taken care of with extra care if you are a diabetic. Number 6. Irritability. Diabetes is also associated with anger issues, sadness, and nervousness due to fluctuations in blood sugar levels such as hyperglycemia and hypoglycemia. Behavioral changes are mostly ignored in most diabetic patients, but usually 80% of diabetics show these symptoms. Low blood glucose levels make you confused, hungry, and sweaty. High blood glucose levels make you feel lethargic, thirsty, angry, and tense as well. To cope with this, one should eat consistently and do regular exercise, meditation, yoga, and psychological therapy to help to regulate mood. Number 5. Slow healing. Diabetics once get a minor infection, it can't be taken lightly because the healing process is very slow. You have to take extra care of your wounds and infections. Due to loss of sensation, You might not be aware of your wound in the first place, and when you see it, it might already be infected. The wounds and infections in diabetics may not stop at one place, and rather keep spreading, involving the whole leg or arm. Sometimes the wound gets so infected that the only possible solution is to amputate the limb. So taking care of your wound, especially the peripheries, is very important. There are certain reasons why people with diabetes have weaker immune systems, and one of the reasons is a decrease in the number of white blood cells. The body cannot use insulin or produce insulin properly, so the body struggles to metabolize sugar. As sugar levels rise, it affects wound healing ability. Number 4. Sexual dysfunction. Diabetes causes sexual dysfunction in both men and women. Sexual dysfunction is common in men, mostly with type 2 diabetes. Diabetes lowers your interest in sex, making it difficult to achieve an erection. The reason for this is limited blood flow to the penis. Constantly high blood sugar levels also affect the structure of your blood vessels and reduce blood flow. Another important factor is diabetic neuropathy, which impairs autonomic and somatic nerve processes that are essential for erection in women. It will lead to low arousal and poor lubrication, but in women, it is less conclusive than in men. Number 3. Numbness and tingling. A constantly high blood sugar level will affect your nerves. People with undiagnosed diabetes for a very long, or people who have poor control over beer, their blood sugar will develop this complication. The nerve might get damaged to such an extent that you can no longer feel sensations, and it is most common in your peripheral areas like fingers, palms, toes, and soles. This also adds to the damage to your limbs because people are not aware of their wounds and infections until they see them or they become infected to a level where there is no reversal. Number 2. Pain in limbs. Muscle weakness and atrophy of the lower limbs may develop in a patient with diabetes, increasing their risk of falls. Diabetic neuropathy most often damages nerves. It comes with many symptoms like numbness, tingling, burning, aching, cramps, and weakness. It is related to prolonged exposure to high blood sugar, inflammation, and blood vessel changes that nourish the nerves. The danger sign is not feeling pain and developing of ulcer on your foot. It is also associated with proximal neuropathy, focal, and autonomic neuropathy. Proximal neuropathy causes pain in the thighs, hips, or buttocks. In focal neuropathy, it affects specific nerves that specify localized pain and cause pain in the wrist or other isolated areas. In autonomic neuropathy, nerves that control automatic functions, such as heart rate, digestion, and blood pressure, are affected, and these lead to digestive pain or discomfort. Patients with type 2 diabetes have a significant reduction in proximal and distal leg muscle strength, and a proximal but not distal reduction in muscle volume, possibly due to greater intramuscular fat accumulation in distal muscles. Number 1. Frequent urination and thirst. One of the earliest signs that most diabetics experience is frequent urination. Daytime urination is not a problem, but if you have wake up at night more than 2 times, then this is concerning, and you must get your blood sugar levels checked. The more you urinate, the more your body will get deprived of water, and this will activate your thirst center, and you have the urge to drink more water, and this will keep you in this cycle. You may experience these symptoms along with frequent bouts of hunger. Since your body can't utilize glucose, your body's cells will remain deprived of energy, and this will give you a feeling of hunger. So if you are having polyuria, which is increased urination, polydipsia, which is increased thirst, and polyphagia, which is increased hunger, you may have developed diabetes or are at risk of developing it. And with this, you have 10 early symptoms that can help you identify your diabetes before it's too late. If you face any of these issues, it's best to get checked by a healthcare specialist. Natural food has a cure for almost every disease. Join me in the next video where I'll be telling you about the foods to increase your testosterone level naturally. Don't forget to like this video, share it with friends, and subscribe to my channel to never miss out on any latest health content. See you guys in the next video.
Hold up, this is policy on the beat.